What I presented today actually is a treatment platform that is developed using T cells that are specific for EBV, not necessarily because we are targeting EBV in Hodgkin lymphoma, although Hodgkin lymphoma can be associated with EBV infection, but in this case, we're using them so that the T cells that are prepared, they are reacting against EBV antigens. And so one of the risks of using cells that come from a third party, like allogeneic cells and infused in patients, is that you may cause graft-versus-host disease because those cells could potentially recognize antigens in the body that are what we call alloantigens. So they essentially drive what we call graft-versus-host disease. But if you make cells that are specific for EBV or any other virus, then those T cells, essentially their targets are proteins from the virus. And so if you infuse them in any body, they should not react against the tissues of the body, but only against any viral particles if they are in the body. And so by doing that, you eliminate the risk of causing graft-versus-host disease using a product that is made from someone else, so not an autologous product. Then those EBV-specific T cells, they're modified to express the CD30 CAR, so essentially a glove that allows it to bind to the CD30 protein that is expressed by Hodgkin lymphoma. And that's how these cells are being used as a strategy to treat those patients. So in most cases, most of the CAR-T cells that have been developed, they come from the actual patient. But in this case, what we want to be able to have is a product that is ready-made off the shelf, so you don't have to wait the number of weeks that usually you have to wait to obtain a product that you can use to treat a patient. And then on top of that, we also know that patients that have had a lot of rounds of chemotherapy, like a lot of the patients that are requiring treatment with CAR-T cells, their own T cells are probably biologically damaged, and so the product that you get at the end may not be optimal, may not have an optimal function. And so if you can make a cell product from a healthy donor that recognizes EBV and that's also able to bind to CD30, then that could be a strategy to use for patients that have relapsed Hodgkin lymphoma. Essentially, that's what our trial is assessing, is to use these cells in patients that have relapsed Hodgkin lymphoma, that is essentially for whom all the standard of care treatments are not working or have not worked. And so we can use those cells into patients and we see responses. We see that these cells stay around probably shorter than what we see with cells that are made from the actual patient, from the autologous cells. But we see clinical responses even after we repeat the infusion. So it seems that these cells appear to have be able to exert their anti-tumor function in this particular setting.